Let's begin our discussion on the approach to the patient with jaundice. Mean that how we will approach the patient clinically if he or she present with jaundice. Before going into the approach, let's define the jaundice. Jaundice is a yellow discoloration of a skin, mucous membrane and sclera, which can result from either the overproduction or the underclearance of a bilirubin. Here you guys can see the patient with jaundice. You guys can see the yellow discoloration of a skin, mucous membrane and sclera. Now a question arises that what is bilirubin? The bilirubin is actually a breakdown product of red blood cell. It arises from a red blood cell. So whenever the red blood cell break down in a reticuloendothelial cell, particularly spleen, it will release bilirubin in blood. This bilirubin is water insoluble and it will attach with albumin to circulate in blood. This is called as an unconjugated bilirubin. This unconjugated bilirubin bound to the albumin will be taken up by the liver. In the liver, it undergo metabolization and it will be released in bile. The bilirubin which is released in bile after metabolism is called as conjugated bilirubin, and this conjugated bilirubin is excreted in feces. Now, whenever there is either the increased production or the decreased clearance of bilirubin, it will lead to the jaundice. So, how we will approach these diseases? Let's discuss it now. So, whenever a patient presents with jaundice, means the yellow discoloration of a skin, mucous membrane, and sclera. So, we know that this jaundice is due to the increased level of bilirubin in blood, and to be clinically significant or mean that to cause the yellowing of a skin, the bilirubin level should be greater than 2.5 mg per dl. So whenever a patient presents with jaundice, the first test is to perform the examination, take proper history and perform a liver function test. In liver function test, we perform ALT, AST and alkaline phosphatase etc. If the liver function test is normal and the patient is having a conjugated bilirubin, then we should think about two diseases, the Dubin-Johnson syndrome and the Rotter syndrome. And if the patient is having a normal LFT, but there is an increased level of unconjugated bilirubin, mean the bilirubin which is bound to the albumin. So in this case, we can think about three diseases. Hemolysis mean that there is an increased breakdown of a red blood cell which is ultimately leading to jaundice. Apart from this, there can be a Gilbert syndrome or the Kreger-Najjar syndrome. Remember that in the Gilbert and the Kreger-Najjar syndrome, there is a absent or the decreased functioning of the metabolism of the unconjugated bilirubin to the conjugated bilirubin. While in the Dubin-Johnson syndrome and the Rotter syndrome, there is a decreased excretion of bile from hepatocyte to the bile duct. So this is how we will approach a jaundice if the patient is having a normal LFT. Now come toward the patient if he or she present with jaundice, but along with the jaundice the patient is having abnormal LFT. Mean the patient is having a deranged liver function test. By the deranged liver function test, we mean that the patient have increased ALT, AST and alkaline phosphatase. The ALT and AST are present in hepatocyte. The ALT is present in cytoplasm while the AST is present in mitochondria of hepatocyte, while the alkaline phosphatase is present in a bile duct. So whenever the patient is having AST and ALT greater than alkaline phosphatase, mean that the damage is greater in hepatocyte. So this is called as a hepatocellular pattern, and whenever the liver function test is deranged in such a way, then we should think about a hepatic diseases. And if the patient liver function test is deranged in such a way that the alkaline phosphatase is greater than AST and ALT, mean that the both are deranged but the derangement is greater in alkaline phosphatase than AST and ALT. This is called as a cholestatic pattern, and whenever these kind of abnormalities occur, we should think about cholestatic disease such as a gallstone, pancreatic mass and the intrahepatic cholestasis. So it was all about the jaundice, that how we will approach the jaundice clinically.